On this visit, I'd like to talk about diagnosing and treating heart failure. Heart failure, what we used to call congestive heart failure, occurs when the heart is unable to pump blood efficiently. There are two types. The first is called diastolic dysfunction, when the heart can't relax properly to fill with blood, the stiff heart. The second is called systolic dysfunction, when the heart's unable to pump blood efficiently, an enlarged heart. A person can have heart failure due to diastolic dysfunction or systolic dysfunction, or a combination of both types of dysfunction. The doctors led to consider heart failure in three cases. First, when the patient complains of decreased exercise tolerance due to shortness of breath or to fatigue. Second, when a patient's found to have edema, swelling in the ankles and feet or in the abdomen. And third, when the doctor finds an abnormality when he listens to the heart, say a heart murmur, or when he gets an electrocardiogram, or when he gets a blood test like BNP, brain natriuretic peptide, which is a test for heart failure, blood test. If the doctor suspects heart failure, he will order an ultrasound scan of the heart called an echocardiogram. Using sound waves, the doctor will actually be able to see the heart beating and pumping blood, and it will show the heart valves and whether or not they're functioning normally. It shows the size of the heart, whether or not it's enlarged and whether or not it's pumping blood effectively, meaning systolic dysfunction. It can show whether or not there has been heart damage from a silent heart attack. The echocardiogram can show evidence of impaired filling of the heart with blood, meaning diastolic dysfunction. There are other tests that the doctor will order if he's concerned about possible heart failure. But the ultrasound heart scan, the echocardiogram, will tell him if you have heart failure. Before I go over the treatment of heart failure, it's important to note that most of the time, shortness of breath with exercise or fatigue with exercise is not due to heart failure, but to something else. And most of the time, swelling of the ankles and feet or of the abdomen is not due to heart failure, but to something else. And most of the time, a heart murmur or an abnormal EKG is not due to heart failure, but it's due to something else, often not serious. That's why the doctor may order other tests before or instead of the ultrasound heart scan, the echocardiogram. And remember that heart failure comes in two types. First, diastolic dysfunction, in which the heart fills with blood abnormally, a stiff heart. And second, systolic dysfunction, where the heart has a decreased ability to pump blood, an enlarged heart. With systolic dysfunction, the heart pumps out a lower fraction of blood than normal. A normal heart pumps out over 50% of the blood in the heart with each beat. This is called a normal ejection fraction. With systolic dysfunction, the heart can only pump out a smaller fraction of blood with each beat, say 40% or 30%, or sometimes even less. The heart has a decreased ejection fraction in systolic dysfunction, a low ejection fraction. It is the ultrasound heart scan that we use to measure the ejection fraction. People with heart failure due to diastolic dysfunction may have a normal or almost normal ejection fraction. But the problem with diastolic dysfunction is that the heart muscle can't relax properly so that blood can fill the heart for the next beat. And treatment is somewhat different for diastolic heart failure than for systolic heart failure. Patients with systolic heart failure should be on 3 different medicines to help prevent or slow further heart damage. First, a diuretic, meaning a water pill. Second, an ACE inhibitor or an ARB. These are types of blood pressure medicine. And third, one of 3 specific beta blocker medicines: bisoprolol, carvedilol, or sustained-release metoprolol succinate. These 3 types of medicine will help a person with systolic dysfunction, again meaning decreased ejection fraction and enlarged heart, live longer and feel better. Patients with diastolic dysfunction, a stiff heart, also often benefit from the 3 types of medicine, but the strategy of use is different from the strategy used in systolic dysfunction. That's it for today. Thank you for visiting, and I hope you found this useful.